And I would go back to you, Dr. Rice, because in all fairness, we're talking about, use the analogy of the car going 1,000 miles an hour, but if we're talking about areas where people are potentially going with no dental care at all, I understand your reticence, but it also harkens back, I think, in the medical field. 20 years ago, a lot of doctors were really resistant to the increase in mid-level providers, and I'm talking about nurse practitioners, physicians' assistants, and of course, we now know they're ubiquitous in medicine, and people have strong feelings about that, one way or the other. My question for you is, yes, you would always love to have the best trained person taking care of you each and every day, but the reality is we know there are underserved communities in this country, and also there are certain procedures where if you've done them enough times and been trained well, you can be effective at them. So how do we address, if we do not allow dental therapists, how do we address these communities where, quite frankly, they're not getting any dental care?
First, I would say the data that we have so far on dental therapists is, although we think they're going to underserved areas, in many, many instances, and I'm going to use Minnesota as an example, they're one of the longest standing states to have this. There are about 100 dental therapists, and only 9 are actually in documented underserved areas. So we're not bringing much more volume of dental care to this underserved area already. We know that. And to me, the simplest solution is, I've been teaching dental students and young dentists for 25 years. So what I know is that population, they have massive student debt, and they're looking for areas to be trained better. So to me, the simplest solution is you marry people who have a strong desire to relieve their debt. They're highly trained, and we connect them with underserved areas of this country. We incentivize the most highly trained people to go and practice in those areas. And then we bring together this group of people who really need help and a group of people who really want to help and need the ability to relieve their student debt, which is insane today.
And before we go, Dr. Warren, you're someone who, obviously you're a dentist and you feel quite a bit differently. Could you lay out the future that you would envision, your ideal future, where everyone is served appropriately?
Yeah, we have 57 million Americans that are going without dental care. And I agree, we need many approaches. Dental therapy is just such an opportunity to do that. It's just also, simple math. Dental therapists, just like hygienists, now free up dentist time to do more procedures. Once dentists didn't want dental hygienists either. Now I would say they can't possibly live without 2 or 3 of them. I foresee a future where that will be the same for dental therapy, and what a great thing that will be for the Americans that go without dental care right now.
And I would just add, as we close here, I never knew when I went into emergency medicine how much dental care would play a role in the emergency department. And I mentioned earlier medicine versus dental care, and the truth is they coincide. You can have dental infection that can lead to life-threatening complications. So I urge everyone out there not to neglect their dental health. We know that good oral hygiene, proper dental cleanings, proper dental care can have not only effects on your oral and dental health, but your overall health. And so that's why it's so important that everyone has good dental care. Dr. Warren, Dr. Rice, thanks so much for sharing your opinions on the show today.